Sakthi Dental Clinic, Mullukurichi. Dental crowns are tooth-shaped caps that are placed over a tooth to restore its shape, size, strength, and appearance. They are commonly used to protect and strengthen teeth that have been weakened by decay, fracture, or large fillings, and to restore teeth that are severely discolored or misshapen. Crowns can be made from a variety of materials, including 1. Ceramic. Ceramic crowns are made from a tooth-colored material that blends in with the natural teeth. They are often used for front teeth because of their natural appearance. 2. Porcelain-fused-to-metal. These crowns have a metal base with a porcelain coating. They are strong and durable and can be color matched to the surrounding teeth. 3. Gold. Gold crowns are made from a gold alloy material. They are very strong and durable and can last for many years. 4. Base metal alloys. These crowns are made from non-noble metals that are highly resistant to corrosion and are very strong. The process for getting a dental crown typically involves 2 appointments. At the first appointment, the dentist will prepare the tooth by removing any decay or old filling material and shaping the tooth to fit the crown. An impression of the tooth will then be made and sent to a dental lab, where the crown will be fabricated. A temporary crown will be placed over the tooth to protect it while the permanent crown is being made. At the second appointment, the temporary crown will be removed, and the permanent crown will be placed and adjusted to ensure a comfortable fit. Once the fit is confirmed, the crown will be cemented into place. Dental crowns can help to restore the function and appearance of damaged or discolored teeth, and can provide long-lasting protection and durability. It's important to maintain good oral hygiene habits, such as regular brushing and flossing, to help extend the life of the crown and to prevent further dental problems. Thanks for watching. Like and subscribe.